everyone, welcome to our webinar series. Today is my birthday and I take this pleasure to achieve this next goal which I was waiting to introduce for a long time. And today has been a great day because it's my birthday. I'm turning 44 today and I am taking this opportunity to launch my webinar series. I will give you a little bit of background about me, people who have worked with me, clients who have been seeing me, they know me. But for those who are new, and if you're joining from any part of the country or world, and I will give you a short introduction. I am Charu. I am musculoskeletal physio and women health physio. I'm a mentor and an owner of Procure Physio and Health Services. I have my practice in Sydney, in Tungabi, and I work around broad range of clientage, which includes chronic pains, aches, and for last 5 to 6 years, I have moved more into women health area and have a very special interest in treating all women health related issues, especially incontinence, prolapse, pain, pelvic pain, and also helping people to navigate their pregnancy and postnatal journey. So today, what we are doing, how these webinar series are going to go ahead is every fortnightly I will be coming live and I will be talking about a topic. It could be a continuation of what I have spoken a week, for example today, or it could be a hot topic which you guys would like me to talk about. So feel free to send messages in the chat or feel free to email us on admin@procurephysio.com.au, or if you can go to our website as well, www.procurephysio.com.au, if you have anything which you would like me to present for our coming webinars. And if that topic is within my scope of practice, I would definitely present it so that I can build a community which is very active and confident to take care of their health needs. So let's start with today's topic. Today I'm going to talk about is growing body aches and pains in 40s. We all think, and this is a very common question which comes my way with my patients who who celebrate their 40th birthday, and they notice that something has changed in their body. They feel like they don't have enough strength. All those aches and pains and stiffness is getting more frequent, and the things which they could do it in 30s without giving a thought are becoming a task. So that is what we are going to talk about in this series. These changes happen both in men and women, but the causes or reasons behind them are different. Today I'm going to aim from this webinar and presentation, it's more about, we are keeping it more towards my female population, and maybe sooner down the track, if there is a request, I can talk about what changes in men which causes these issues and how to navigate that. So let's get started. Growing body aches and pains in 40s. We are going to look at how we build strength, how we prevent bone loss, and how we move with confidence, avoiding any falls and fractures and injuries. So what happens? What do we feel when we touch 40s or we are in our 40s? We there can be a little of bit of variation as well. Some people start feeling these, some women start getting these changes bit earlier. If they start feeling these changes at 35, and some do find it towards the later part of 40s, like 45, 46, 47. So what are the common aches? What are our main issues? What we feel? It can be either stiffness. It could be your knees feeling a bit more stiffer, your hips, your shoulders, your neck, your mid back, your lower back, and then you're getting low back pain. Everyone gets a low back pain at some stage of their life, but this is more frequent and they last longer. The thing, you could have sometime in your life you could have had a back pain which could resolve with some self-managing strategies in 1 or 2, but now these pains linger until unless you don't seek help. You end up having long morning stiffness. Your body wants, you wake up, you feel stiff somewhere until unless you start moving or do something about it. You do feel stiffer. Your body asks for movement. And as I said before, earlier, we all have some aches and strain. We have gone through some strains or injuries, and few things it was very quick and easy to recover, but now it takes longer. So now what we are going to analyze here is, or look through, is like why these change, what happens, why this happens, and what has changed. Is it a natural aging process? Are these any lifestyle factors? So we do question ourselves a lot. What has changed? What suddenly, why I am going through this? And personally, me being, as I said, I have turned 44 today. I have gone through, I have felt these changes myself, and that's why I chose this topic to be the starting point of my webinar series. So with all these changes, what is happening is, I'm going to skip a slide here, moving to the next one, giving you a bit of background about what is causing what you're feeling now. Why sudden drift in all those symptoms or which I discussed before. As we reach close to 40 or 40, women start moving towards we are in our perimenopause journey. Yes, perimenopause is something which happens before menopause. Perimenopause is something which leads us into menopause. But we do have a big window or big time frame when we are going through this journey. So what happens during perimenopause and menopause is what makes the difference, and how to navigate is the most important question. So as we get into our perimenopause window, some female, as I said earlier, can happen even at they can get into perimenopause at 35 years old. It can be anywhere between 35 to 45. Usually by 45 we are in perimenopause phase. But so what happens? Mainly it's the change in the hormones which drives our perimenopause and menopause journey. So what happens is, very important hormone which you would have, common one which most of you would be aware of, estrogen. Estrogen starts dropping down. There are other hormones which I'm not going to talk about today. I want to keep it as simple as possible. They are changing as well, but it's mainly estrogen decline which leads to different symptoms. So as the estrogen declines, it's a very important hormone for pregnancy, for our menstruation cycle, and it has an important role. So estrogen, even in our normal menstrual cycle, estrogen level change from every phase of our menstrual cycle. So as the estrogen goes through that dipping phase in our menstrual cycle, especially in our perimenopause window, it affects us in a different way. It's constantly now, it's not just dipping in the, it's not the change which you are feeling during your periods. It's more of like a constant decline happening as you get into this perimenopause phase. What is the role of estrogen? Estrogen is a very important hormone which helps with keeping our bone growth, bone density at pace, and it is the hormone which, with the decline of this, it can impact our bone. It can increase the bone density by affecting the cycle of regeneration and degeneration in the bone tissue. So that is where this whole thing begins. With the decline of estrogen, our muscles, that was how estrogen affects bone. It does bring a changes to our muscles and ligaments. Our ligaments get a bit more stiffer with the declining estrogen, and then our muscles, because tendons, they all get a bit more stiffer. They have less capacity to expand how they were doing in our early years when we were in 30s, 20s, or younger time. So it loses its tissues start losing their extensibility, which can lead to make us more stiffer, injury prone, and leading to all those degenerations and load management as well. So that is a little bit info background about how we get towards the issues which I mentioned, like the symptoms, how they take so longer, why they are so frequent, and why we feel like what we feel like now. So now that was more about how the estrogen and everything is linked. Estrogen also does change affects our urogenital system. We do get more, our tissue gets thinner around our genital areas, with our vaginal openings, and our skin around there, it gets very thin, and it can lead to we start feeling more dry, and it does lead to issues or pain with our sexual life. We do start feeling pain with intercourse. And also other thing what it does to us is we start feeling our urge to go to the toilet gets more frequent, and we start feeling that we are losing control. If we don't go to the toilet, we can end up leaking. So those changes happen, they're happening behind the scenes. It's not just estrogen is only affecting our bone, it is affecting all the systems at the same time. And we do get hot flashes, we do get other kind of symptoms. It's a long lasting list, but for today's presentation I'm mainly focusing on your bone health. So this was a bit of background information. So with how as the physio I can guide you or inform you what are the small things you can do to help and support yourself in this journey. And I can assure you that movement and exercise has a very, very important role. You can see this picture where she is in a thinking mode. What should I do? What has changed? What has changed? How can I continue to do what I was doing before? So you need to find a time, first thing, time and space for yourself to start doing the things which you have putting in a back pocket for a long time. So you need to buy yourself at least 15 to 20 minutes in a day. And then once you get into that habit, that's when you can kind of like build up your longer routine. What changes with being active? When you're active, what happens? Your muscles are working and it has both the cardiac benefits and muscle benefit as well. When you're just being active, going for walks at least 30 minutes a day for 5 days a week can do a lot for you. And if you end up walking a bit more faster and longer, like at a faster pace, bringing your exertion rate to where you're walking but you can still talk in sentence is good way to start if you have never done any exercises before. So I would suggest you to walk and get to a walking regime, at least aiming to do like I'm recommending as per guidelines. It says 30 minutes a day, but even if you can start with 15 minutes, it's better than nothing, right? But you need to try walking a little bit more at a pace which brings your heart rate up, and you are walking. It's not a leisure walk where you're just looking at trees and plants and flowers, and it's not going to change much of the things, but you need to give yourself a little push here, right? What happens is I'm kind of like mixing my so now here I'm going to go off track and talk about, because I'm a musc physio from background as well. So yes, our body is going to age, right? Everything is going to change. This was one of the a question which was put forward by one of my lovely patient I've been treating for a while, that how do we know that this is related to perimenopause, or this is our natural aging thing, what we are going through? Yes, and very validated question and very good question. So thing is that our body is going to go through changes. We are going to go through aging. Osteoarthritis is something which we all are well versed with, but at what rate it's happening, and with these things in the background, how your hormonal changes are affecting it, it can get escalated. So that is where you need this support to not have those changes happening at a very faster pace. If you put effort doing things slowly and build the right habits, it can help not developing osteoarthritis at very early age, right? So that would be something you are also helping, not just with your perimenopause but or menopause. This is where you are kind of like pushing that osteoarthritis further back. Now there is a role of low impact exercises, or what we call as aerobic exercises as per research, which can include swimming, walking, which I already explained to you, and cycling. There is some but for your bone health specifically, as per research, it's more of a resistance training, which does help in getting our bones more tougher and stronger. So everyone should have some form of resistance training along with the aerobic exercises. As I said, swimming, walking, cycling, yes, it does load our joints, but strength training is very important because it can be with your own body weight, and you don't have to start. When I'm saying strength training, it's not just thinking about lifting heavy weights. It can be any form of load. It can be your body weight, it can be resistance bands, the tubes or those bands, or it can be weights or machines. Any of those easily available equipment you can add into your daily exercise routine. And as per research, we should be at least spending 4 strength training sessions. We should be having 4 strength training sessions per week, aiming to push ourselves to do at least 60 minutes of exercise based on resistance training. But sometimes we don't have that much, not most of the time, we don't have that much of time. We are talking about research, and at the same time we are here looking at what is doable. So how I tell my clients, or how I work with it, is finding a small batch size workouts, trying to allocate, even starting with 20 minutes, 15 minutes, working and building it up slowly and gradually. Once you fall in love with doing exercises and activities, is something which is going to take you towards finding time to do the longer sessions. Nothing goes in vain. It's like nothing gets wasted. So even if you block 20 minutes on a day where you're not going for a walk, and then you start doing some specific exercises for particular muscles and joints with the resistance bands, tubes or weights, which is going to load your bones, get your muscles stronger. Because ultimately, if your muscles are strong, that is what is going to take the pressure off from your joints. And again, if I link it to my osteoarthritis education part, it's more of like, yes, we need to offload our joints. And how we offload the joints, we are going to have our natural changes as well into our ligaments and muscles and joints, is by building up our muscle support system. Because as we get into perimenopause phase, we start losing our muscle, what is called girth, and we lose our lean muscle mass as well. We start absorbing more of, like, we start retaining more fat and adipose tissue. And that is my advice for strength training, how you can incorporate it into your daily routine, and it is backed up by research. And then, yes, another question is, or another thing, when I ask what you do, are you doing any exercises? Yes, I do stretches and yoga every day. Wonderful. Stretching and flexibility work is important, but you need to balance it out. Everything has its role, but for your bone and muscle health, yes, we need flexibility, we need stretching, but it should not be just stretching every day kind of routine. You need to get a workout where you do a bit of stretching, you do some yoga, like 1-2 days, and then you need to load yourself with strengthening exercises. Because if you're too tight and you want to get into strengthening straight away, you might end up injuring yourself. It has, as I said, it has its role, but then it's all about balancing out everything. It's not just doing stretching is going to help you with the bone, improving your bone or muscle health. Yes, so flexibility, strength, and cardiovascular training, they all have their own space, and how you space it around, that is a good combination or good soup of everything is important. Now coming to my next point is this is the window where you will start getting more injury prone as well, right? Yes. One good news about this estrogen part is like when it changes with our it's research backed up, that when in early young females, high estrogen, as I said, high estrogen is equal to more flexibility, right? That's what we are kind of inferencing. And low estrogen is making your muscles more tight and stiffer. So when you had more flexibility, but it would invite more injuries as well, like ankle sprain and stuff. And when you're in different phase of your period cycle, that's a completely different topic. But just to give you a little bit of idea, it doesn't lower the risk of, if you're someone, you have heard like now we have low estrogen and it should help your muscles and joints and you're less injury prone. It's not like that, because your muscles and your ligaments are now gone more stiffer. You are not as flexible as you were before. It kind of like can make it, when you load it with, all of a sudden you load yourself with heavy loaded workout or day-to-day activities, you get more prone to those aches and pains. I hope that makes putting it all together gives you a better understanding of the main heading of this topic of this webinar, like why you get more in 40s. So it's to deal with all those things. The combination of what's written on this slide is the best way to go ahead. Warm up is very, very important if you're trying to get into a new exercise routine. For those who have never exercised in their life, after watching this video, don't jump up straight into doing fancy stuff because, oh, this is what's going to help me. You need to build it up slowly. As I said, you can start with 15 minutes, 20 minutes, but then it's more of like, what's the right weight for you might not be a right weight for the other person. When I say weight, I'm talking about the resistance in any form, like resistant bands, tubes, or dumbbells, all those equipments which we can use for strength training. Everyone has their own capacity and everyone needs to get that number which is right for training. It's not under training and overtraining, kind of like we need to get our right weight to work with. So that is, to summarize this slide, what I would like to say is, in our life, we should, if you have never done it, you need to start somewhere, finding 15 minutes or 20 minutes every day to work on something. So you need to either start going out for walks, maybe 20-minute walks, first thing in the morning or last thing in the evening, doesn't matter. At least 5 days a week, and then you build it up to 30. You need to walk at a faster pace, so you're feeling that you're doing a bit of workout, but you can walk and still you can talk in a sentence, or you can push yourself a little bit further. Then coming to strength training, as I said earlier, summarizing it, you need to find the right resistance for your body or like different muscle groups, and you need to put your joints and muscles through that load with certain amount of sets and reps, and ideally it needs to be 4 times a week, and it needs to be done at least for an hour. And as per research articles, it's more of like you need to do it consistently for at least 4 to 5 months to build your strength and joint muscle strength and to offload your joints. And if it's more of like, yes, if you don't have that time, you can start for 15 to 20 minutes. You can pick and choose what area of your body you want to work. You can pick certain exercises aiming for, let's do upper body, let's do lower body, let's work on our core stuff. And then yes, you can introduce stretching as a routine in the warm up part or cool down part, which keeps you more flexible. Or you can do twice a week, kind of like if you have time, you can do twice a week more of a stretching and your flexibility work. But don't expect that stretching and flexibility workouts are going to get any change in your bone strength or bone health, because this is the window where if you have never done exercises in your life, the chances of having osteoporosis are very, very high. So I've already spoken about hormones, and I'm moving to the next part, which is lifestyle factors. Yes, coming to lifestyle modifications, it is very, very hard to change your habits. You need to build up a time where you get to sleep on time. You need to at least aim for sleeping for 8 hours. Healthy sleep gives you time for your body to recover from all the things you have done in that day. You need to keep yourself hydrated. When I'm saying hydrated, you don't have to drink 3 to 4 liters of water. Anything between 1.5 to 2 liters is okay, until unless you're not doing any heavy loaded activities or it's a very, very hot day. You can look at, I'm not a dietitian or naturopath, but you can look at the list of anti-inflammatory foods which you can add into your regime and work through it. Or you can see a dietitian to seek some help if you're getting bloating and you're finding it hard to work with your metabolism, because the metabolism gets very slow when we are in this phase. And when we work on your food and all that stuff, that is where it's like stubborn weight which doesn't want to whinge. That's where all these other things will come into. But because I've just added it for the completion, because today it's more of like talking about aches and pains and how physio can help and how exercise can help. And if you have some sore aches and pains, or you can use some heat pack or ice at some time. I think I'm running a bit short on my time for this webinar, so I might explain these things a bit more further in my next webinar in description. There is a reason when to choose heat and when to use height. We can talk about posture awareness and how you can look after your ergonomic stuff at work, and then some recovery techniques. So that would be my topic of my next webinar. And thank you for joining live. And if you have any questions, feel free to send us, and I'm more than happy to answer those questions. Have a good day. Bye.